Hi, my name is Yadith Fernandez, and this is my end of semester journal. In this end of semester journal, I will be talking to you about my experience with all the major assignments and with the overall course. I actually found this course very helpful, very informational, just getting me ready for the next steps in my career, in my academic career, and my future professional career. So, let's start off with the engagement and advocacy proposal. The engagement and advocacy proposal was, to me, actually very easy. I know that my interviewing skills aren't the best, so my interview was a little bleak. But other than that, choosing a topic to advocate for wasn't even a question for me, since I had been advocating for the same thing for over 3 years now. I have been advocating for universal health care, and I've already worked on several projects advocating for universal health care, so I just thought that it would just be easier for me to continue with that. So for my proposal, I basically just wrote out why advocating for universal healthcare was important and how it can help, and why I think that it is worth being my whole semester project. Overall, on that one, I did pretty good. The general analysis is the next major assignment. That one I struggled with a little more because I've never been good at comparing things. I've never been good at hey, compare this to that, because I really don't know. But I did a lot. It took a lot of researching how to write a general analysis. I went on and did my own little YouTubing and stuff like that to figure out how to write one. And that really actually did help, along with the instructions that the professor gave. It was overall pretty simple, pretty good. The general analysis, obviously, it was on universal healthcare, and I did it between a YouTube video and a peer-reviewed article, just to make it easier for me to find the differences. And then I compared the ethos, logos, pathos, and the overall structure of the two. Then after that assignment was turned in, we did the local field work, and I'm gonna kind of plug in the broader field work with that, because to me they were very similar. The broader field work was shorter than the local field work, because the local field work we actually had to do our own survey, and then we had to do a local survey or article and the national survey or article. For me, it was a little more difficult to do both, to find a national and local survey, because since universal healthcare isn't implemented in the U.S., it's just a lot of, do you think it should be? I was able to find surveys on how many people in the U.S. and in Texas have insurance, don't have insurance, how many struggle to pay. So I was able to compare that to my survey, and overall, the people I surveyed basically agreed that the U.S. healthcare system is not affordable and it's not accessible, and the majority of the U.S. and the majority of Texas actually agreed, which I didn't find to any surprise, because I've personally been struggling with the healthcare system and the insurance policies of the U.S. After that, it was the PSA, which I actually had signed up to do the PSA with another group, but I ended up doing 2 PSAs because I just really liked my topic of advocacy. I really like advocating for universal healthcare, and even if the PSA is only seen by the professor or by 10 people, I wanted to give it a try and see what my video skills were like. I ended up having some misspellings, which was a little embarrassing when I submitted it and saw it. So, piece of advice: look over your work before you submit. I'm pretty sure everybody knows that. I was just in a rush, but I really enjoyed doing the PSA for universal healthcare, and the reason I felt like sticking to it and ended up doing two was because I felt like the stories of the people that I spoke to during this semester to complete my project needed to be heard. I feel like these people really shared something very personal, because talking about healthcare isn't easy, and it's controversial, and for some it's very, very personal, and it can bring up a lot of emotions. And when I spoke to these people that I surveyed, and people that in general were just helping me with this project, they poured their hearts out to me. They poured every ounce of emotion in explaining to me why they felt like the healthcare system in the US needed to be changed. And I knew that they wanted these stories to be seen, they wanted these stories to be shared, and I didn't have the resources to put all of them, but I did put a couple that I thought stood out to me, that one that one of the testimonies for my PSA actually kind of summed up a lot of the others, and the rest were actually very sad, because they're things that the most of us don't think about, like how autoimmune patients struggle with insurances in the healthcare system, because the healthcare system in the U.S. is their insurance policies are always looking for the cheapest options. And then the other was how not having health insurance can sometimes be easier than having health insurance, and in terms of like labor and delivery and certain treatments and even medications. So I did share those testimonies because I felt like they deserved to be heard. And overall, I think this whole semester project was really eye-opening, because it helped me group my thoughts together. It helped me learn how to put my opinions aside, and put not my opinions but my biases aside, and how to contribute my thoughts to research that's already out there, how to put together research to help support what your message is, whatever that message is, whether it's climate change, whether it's universal healthcare, whether it's women's rights, and all of the above. This whole class is basically a template for what most of us will be doing for our future, if you're in a STEM field or a public service field, or honestly most scholarly fields. And the class was honestly very, very fun. Professors really funny. And that's it. Thank you for listening. Bye.